Hi everyone, my name is Lauren and I'm a counsellor at the City of Glasgow College. This is my colleague Heather, who's also a counsellor.
Hi everyone.
So today we're going to be talking to you guys about isolation during COVID. It's been 7 months since the pandemic started in March, and since then there's been a lot of ups and downs experienced by, I'm assuming, most people. Recently we've just had new guidance from the government regarding restrictions, which has prompted us to release this video to chat about, the impact that it might be having on some of our students. So I think kind of some of the things that we'll be talking about is the restrictions and how it has kind of been a sort of whirlwind of emotion. There's been times when isolation might have seemed like quite a relaxing thing to happen. There's maybe not the same pressure to socialise for a lot of people who might experience anxiety around that. There's also loneliness as well that a lot of people have experienced, boredom maybe, frustration. So there's a lot of different emotions going around with that, and I think that has a huge impact on mental health in general.
Yeah, definitely. I think some people would have thrived during this time because they would have welcomed the kind of restrictions and welcomed not being able to have the pressure of social interactions, but we all have a threshold when it comes to social interaction and feeling connected. So even the most introvert of us need to have some sort of human connections, which is part of our needs. But I think, there's differences between short-term loneliness and long-term loneliness and how that impacts us. Short-term is a time where we might not have had any connection with someone for a short period, but there's always the kind of promise of it coming. There's always an expectation. There's always a control that we can have with that. And you're able to build resilience and bounce back and feel replenished after that as well. Yeah. Long-term loneliness is something of a different field. It can be quite chronic, and because you're right, the pandemic doesn't seem to be slowing down. Things seem to be kind of gaining momentum. Things seem to be speeding up. There's a lot of confusion. It means when people feel a lot less in control of being able to kind of be connected with people, but also a lot less in control of their emotions and responses to that.
I think, yeah, exactly what you're saying, Heather, is really, really important. And I think there's something around there not being an end date to the imposed kind of isolation and loneliness. As you were saying, sometimes, taking time for yourself can feel really liberating and really empowering, and you can come out of that time feeling refreshed. And, as human beings, we are social animals, and even, some people need more social interaction than others. That I think the point of this period of time is actually it's something that is maybe being imposed on us rather than a choice that we've made ourselves. I think that within that as well, there's ways that we can reach out, and I think that I've heard this quite a lot, reaching out to someone, getting support from people, getting support from the college, whether that's your lecturers, counselling staff like us, friends, family, but it's not as simple as just reaching out.
No.
There's always barriers to that, whether that is the fact that now everything is most things in the college are being done remotely. So, with regards to our role, it's either Zoom or telephone. With, students in college going to class, it's Zoom or telephone mostly. So, that creates barriers in itself with connection, and with connecting with other students and with connecting to the college in general. It's much easier to sort of switch off.
Definitely. I think, given that we've now had to adapt to a place of working behind a screen or working behind a phone, it's now difficult to then picture yourself being face to face with people again. So students may have a blended learning approach where they're doing Zoom classes, but they're also doing practical classes at the same time. And although, like, rationally, you would think that having a practical class is great because you can see people, physically see them, you can be near them, although, with the social distancing, but you're actually talking to someone face to face, and that can feel, really warming and nice and kind of like, build your energy back up. But there's a lot of anxiety around about actually the steps of doing that. So the thought of preparing yourself to go into college or going into these places, preparing yourself to travel, to be around small groups of people, preparing yourself to be in a large building, and preparing yourself to be in a kind of bubble, a social bubble
Yeah.
with people.
The anxiety
And
actually COVID, you know,
yeah,
people feeling more reluctant to socialise, not only because they're not used to it or it feels a bit daunting, but also, you know, the danger of COVID. And I think that's
yeah,
something that's obviously going to make people feel
yeah,
quite anxious, especially if there's
yeah,
people in their life that are maybe more vulnerable, or if
yeah,
they're more vulnerable, if
yeah,
they're shielding, if they know people that already have tested positive for COVID as well. So there's all that worry for
yeah,
students as well.
yeah,
Um, and I think that, you know, people have different barriers to
yeah,
tackling their own isolation.
yeah,
And it's not as simple as reaching out and being able to talk about your feelings, or how, you know, if you are feeling suicidal, if you are having low mood or anxiety,
yeah,
and the different coping strategies that might have transpired for you over this year. Some might be maybe things that you're not used to. It might be that your alcohol intake has increased, and your
yeah,
drug use has increased.
yeah,
It might be that you're withdrawn, or
yeah,
maybe self-harm, and
yeah,
then maybe suicidal thoughts and feelings might have emerged as well. So these are all difficult things to talk about. And I think that that first step of reaching out for help can be really daunting, you know, with
yeah,
isolation as well.
yeah. I guess, you know, people who are self-isolating because maybe they have had that indication of tracking and tracing, they've been notified that they've been, you know, within the presence of someone with a positive COVID test, or they've tested positive themselves and they'll live alone. I think that part as well, you're right in touching on that there. That's really important to really kind of bring into here, because how can you socially and connect with people if you've been told to isolate, if
Yeah.
you haven't been given a choice on whether or not to isolate or not, you've been told to do it. So there is a kind of a feeling of helplessness and a feeling of lack of control over about that situation.
Yep.
And although we live in a digital age, it's really difficult to even find sometimes the motivation, or even the kind of I guess the kind of bravery of being able to kind of tell people over the phone, on WhatsApp, on Zoom, on Messenger, actually how you're feeling without judgment, or feeling that you're going to be judged for feeling that way. Because I guess the response that some people might expect is, oh, we're all going through it. We're
Yeah.
all going through this. This is all something that everybody's doing, but actually this is an individual experience for you. And
100%.
I think it's really difficult for some people to kind of detach from that, because we're all going through something similar.
So in those times when, you know, students might feel really daunted by the prospect of reaching out, what do you
Yeah.
think that, you know, they can do in those times? What do you think could be helpful?
I think, you know, people need to maybe think about actually what's stopping them, what's their barrier between reaching out, what do they think is going to happen, what's their fear of doing that, because sometimes it is anxiety that actually gets
Yeah.
in the way of that. So maybe even just taking some time to reflect on, what is this for me?
Yeah.
Why is this happening? What am I so scared about? And thinking about that. As soon as you get to that point, then you're able to kind of go, right, okay, is this actually a real fear?
Yeah.
Or is this a fear that I've created? Is
Yeah.
this something that I'm doing to actively hold myself back from doing this? So sometimes you put yourself in a position of feeling stuck and unable to do these things. But actually the fear is the thing that's kind of driving it all. So as soon as we start reflecting on that, I think it'll be good for people to then have the awareness to move forward from that.
And I think that's the important thing, isn't it? It's real versus perceived fear.
Yeah.
What actually is something that we are in danger of, and what is kind of more kind of emotions based.
Yeah.
And I think in those instances, breaking things up in your day into more manageable tasks,
Yeah.
instead of being like, okay, today I'm really struggling, so what I'm going to do is I'm going to try and connect with people by joining, you know, a Zoom exercise class or something like that. It could be something as simple as, today I'm going to get out of bed, today I'm going to shower, today I'm going to, you know, try and make myself something to eat, you know, just break it up into smaller things that are achievable, that you can kind of work on and make you feel like you're actually looking after yourself a little bit. And even sending one text to a trusted person, you don't need to be pouring your heart out, but just something simple like, hey, how are you doing? Just that small kind of gesture, which can spark a lot of conversation around that.
Definitely. I think, it doesn't have to always be somebody that it could be, using helplines or using the text messaging service from Young Minds. That can be really good as well, especially when you are feeling in crisis or you are feeling that you need to connect with someone right now. Then these are really rapid response services that you can use. But what you're saying about chunking down your day, like making sure that you're having a goal to focus on, doesn't have to be wild and wonderful. It just needs to be something that's going to be attainable and achievable. Can not only kind of make you feel more connected to the surrounding world, such as reaching out to someone or making that text. It can also give you other positive outcomes, such as not feeling as bored by having the motivation to actually do something, encouraging that motivation. And allowing yourself to actually feel achievement and feel positivity during your day. We always have kind of these negative days where right now nothing seems to be going any different to what it was like in March. Things just feel like they're being stuck and stagnant and nothing's really changing. And right now we're looking for some sort of positivity in our day to kind of break that up and to actually say, listen, this was a really rubbish day because all these things went wrong, but this one good thing happened, and that's the thing I'm going to focus on, because that's the thing that probably gets lost in all of it.
Definitely. Thank you so much, Heather. You can get some more information on COVID and isolation on our website, which is cityofglasgowcollege.co.uk. And as ever, for any students that feel that they could do with a little bit of wellbeing support, they can book themselves in for a wellbeing assessment on My City by going to apps, bookings, and wellbeing assessment. Thank you so much for listening to this, and we'll have more content around kind of COVID and advice for managing loneliness as well. Thank you.
Thank you.